You're listening to Upgrade Your Health and Wellbeing podcast. Take care of your health and change your habits for the better.
A warm welcome to another episode of the podcast.
Upgrade Your Health and Wellbeing.
So, Eric, what are we going to talk about today?
We are going to talk about aesthetic medicine and Endolift procedure in particular.
Therefore, I must say that aesthetic medicine has changed a lot in Poland, and our health and sometimes our well-being also depends on aesthetic medicine.
We need to bear in mind that everybody wants to look like Marilyn Monroe and Brad Pitt, but unfortunately, most of us do not look that way, and everybody is in search of something that could be beneficial in this respect. And as far as I know, Endolift procedure is one of these options that can be still non-invasive and highly beneficial. Correct me if I'm mistaken.
I absolutely agree. The Endolift procedure is not a new procedure. It dates back to 2009, but at the moment it's experiencing enormous popularity around the world. This is due to many things, but above all to trends, because these trends are increasingly moving towards naturalness.
Yeah, as far as I remember, this is, as I said, like non-invasive procedure with a diode 1470 nanometer, right? That is applied into the skin.
Absolutely. I have to say that Endolift is a procedure that we perform using a diode laser. The most important part is the Endolift tip, which is the optical fiber, because the laser base itself has remained unchanged for many years. However, the tips simply differ in their power and also their diameter. We have 300 micrometer tips, which are used for procedures performed on the face, and 400 and 600 on the body. And it works on the principle of a two-stage action, so to speak. If we set very strong, very high parameters, which we introduced recently and call Endolift X, we have the ability to dissolve fat tissue. If we lower these parameters, then we have the option of tightening the skin and sometimes performing both procedures at the same time.
But let's get back to the very beginning, because I'd like to ask you about indications, because as far as I remember, there are certain indications, these being face and body. And in terms of face, this is like jawline, right, area, absolutely. Marionette lines, skin laxity after weight loss. And in terms of body, we are talking about arms, we are talking about like legs, am I correct?
It is the gold standard for the face because of the jowls, as we call them in Poland. Although I know that this name can be different in various countries, it's simply the lower and middle part of the face that ages, which then makes us less resistant to gravity. Besides, collagen is the most abundant protein in our skin, and unfortunately, its amount starts to drop significantly with age. As a result, we see this kind of skin sagging.
Are you talking about like sagging face, right?
Exactly. And in that regard, Endolift is the gold standard for helping ourselves so that our skin simply sags less.
Therefore, my next question, who is an ideal candidate?
It depends on the indications. The ideal candidate can be younger people who want to build a kind of collagen bank, that is to overproduce collagen a bit and increase skin tension, and then we work exclusively on skin tension, or older people over 35, 40 years of age, when we start to see more and more sagging jowls who want to not only tighten their skin but also reduce that skin overhang. A very common indication is also the double chin, because Endolift allows the Endolift procedure to also reduce the fatty tissue in this area. But there are many more body parts we can treat. Sometimes the procedure is performed around the eyes, especially the lower eyelid, but let me remind you, this is a procedure we perform only on patients who do not want to undergo a surgical procedure, which in this particular case is the gold standard. However, the procedure can be performed on the body, for example, the abdomen, ideally, whether it's post-pregnancy or after a previously performed liposuction procedure. Remember, liposuction doesn't mean that we get a perfectly flat stomach. Sometimes there are areas that require additional correction. Some people, well, in Poland, we call it pelicans, meaning the inner side of the arm. However, it is also very often the case that the thigh area, especially the region just above the knees, the buttocks or the neck, is also a very common area where this procedure is typically performed.
I need to ask you some other questions. Some patients are afraid of pain, obviously. And I gather that anesthesia can be applied, but we are talking about topical anesthesia. There is no need for general anesthesia because the procedure is, we might say, rather painless.
In the past, anesthesia was not used at all. I had the procedure done without anesthesia, and as you know, I'm not very brave, and I managed it just fine. But currently, the gold standard, as I mentioned earlier, is the use of anesthesia. We use an anesthetic that is injectable, and the purpose is twofold. First, we want to anesthetize the patient so that the procedure is comfortable for the patient and for the doctor. Second, we want to properly hydrate the tissues because then the laser light works more effectively. Therefore, at present, I anesthetize every patient to have that twofold comfort, but most importantly, to make the procedure more effective.
I read that the first results are not immediate. It takes about like 2, 3, 4 months for the results to reach their peaks. Is that correct?
Even up to 6 months, because let's remember, the collagen simply needs to multiply. For collagen to multiply, the right conditions are needed. This means, above all, we must avoid stimulants, especially smoking cigarettes, but also limit alcohol consumption, get enough sleep, and most importantly, take supplements or eat an apple. Remember, Arek, there was that saying, an apple a day.
Keeps the doctor away.
So the apple serves to give us vitamin C, which can also be taken as an external supplement. It is, among other things, a substrate for collagen production.
And last but not least, the very last question about safety and side effects, because obviously we need to bear in mind that there is always the benefit-risk ratio. Here, definitely there are a lot of advantages, but we need to mention at least theoretical side effects that may occur.
First of all, if you are in the hands of a professional doctor who can be found on the manufacturer's website, then you are in safe hands because every one of these doctors is trained in this procedure and the side effects are very rare. The most common side effects are simply skin redness and skin thickening, which is common, but it always goes away without any major issues. Sometimes there can be irritation of the facial nerve, which also resolves in 100% of patients. That being said, it is very rare, occurring in less than 1% of patients. But I must emphasize the operator is what matters. Whether they have a lot of experience, are well trained, and know how to handle this equipment and this optical fiber. You mentioned the area earlier, the so-called Marionette lines, where we have a great many different kinds of blood vessels and nerves. This is not a procedure for every doctor, but when performed in this area, it gives very good results. You simply have to know how to work with it. Therefore, I must emphasize, you have to go to doctors, female or male, who are simply experienced.
Obviously, trust is of crucial importance here because each of us wants to look good, look well, and therefore we take advantage of certain procedures, Endolift being one of them. Thank you very much for today. Looking forward to seeing you next time. See you then.
Upgrade your health and well-being podcast. Take care of your health and change your habits for the better.